With shoulder arthritis, it's a progressive problem. People develop pain, and then over the years, it gradually gets worse. Sometimes it gets to the point where it's so severe you can barely move your arm. When that point occurs, we talk about shoulder replacement surgery. Shoulder replacement surgery is where we replace the ball with a metal ball and the socket with a plastic socket, or sometimes we do something called a reverse replacement, where we replace the socket with a metal ball and the ball with a socket. When we're performing an anatomic replacement, the conditions need to be just right, in the sense that your rotator cuff attachments, which are the tendon attachments in the shoulder, need to all be working perfectly. If those aren't working, then an anatomic replacement is not the right choice and won't work for you. And we would do something called a reverse replacement. When all things line up and we can do an anatomic replacement, the concept is we make an incision in the shoulder, move muscles out of the way, we expose the shoulder joint by cutting through one of the tendons in the front part of the shoulder. That's my trap door that allows me to get into the joint. That opens the joint up. We replace the socket with a plastic socket. We remove your ball and put in a metal ball. And then when we're done, we repair that tendon on the way out. Now we have metal on plastic instead of bone on bone, which is what's happening when the shoulder is arthritic. In the event that you have a torn rotator cuff and arthritis, you would be a candidate for something called a reverse replacement. We also will use reverse replacements for folks that have severe glenoid wear problems, and there are other complications and other challenges that we solve with a reverse replacement that we can't solve with an anatomic replacement. When we're doing a reverse replacement, we call it a reverse because we replace the socket with a ball, and we replace where the ball was with a socket. And the reason we do that, the rotator cuff, which would normally hold the ball centered on the socket, is deficient. As a result, there's an imbalance between the muscles, the deltoid, which is here, which lifts the arm up, and the rotator cuff. Without that, the native ball that was here before the replacement would rub on this bone here and cause pain. When we put in the reverse, we put a metal ball here, we put the socket here. Now this bone sits in a lower position and it won't rub on this bone here. And it allows the arm to move freely, and it also eliminates the pain from the arthritis between the original ball and socket.